In the pristine environment of modern clinical medicine, some challenges emerge from the most unexpected, microscopic origins. Welcome to a detailed case study presentation from the journal Microbiology and Infectious Diseases. This research is authored by Dr. Antonio Marco Miotti, Assistant Medical Director at the Infectious Diseases Consultancy Service of Cittadella Hospital in Italy. Today, we examine a rare clinical phenomenon known as myiasis, an infestation caused by the larvae of dipteran insects, commonly known as flies. These larvae typically develop within the dead or living tissues of vertebrates, including both animals and humans. While it can affect various species, the potential for severe tissue damage makes it a significant clinical concern when encountered in human patients. Interestingly, this condition is relatively uncommon in high-income and temperate countries, such as the regions where our medical team operates. However, we recently encountered and managed a specific case of myiasis in an elderly patient with complex underlying health factors. The patient was suffering from two significant comorbidities: advanced cutaneous neoplasia of the parotid and auricular region and chronic lymphocytic leukemia. These conditions, particularly in an elderly individual, created a state of heightened vulnerability, allowing the parasitic infestation to establish itself. The infestation was located specifically in the left auricle and the parotid district, where the larvae had begun their development within the tissue. Clinical symptoms of such cases often include intense localized pain, hearing loss, and a characteristic foul-smelling discharge from the affected site. Of critical importance to our management was the identification of the larvae. Our team conducted a thorough entomological analysis to determine the genus. The larvae identified belonged to the genus Musca. This was an important finding for our clinical strategy and overall prognosis. Musca genus flies generally exhibit a low pathogenetic potential. This categorization led us to define this as a case of facultative myiasis. In facultative myiasis, the larvae usually feed on necrotic or decomposing tissue, rather than being obligatory parasites of living healthy tissue. Treatment required a multifaceted approach. The first and most critical step was extensive surgical debridement of the infested areas. This involved the meticulous mechanical removal of all larvae to prevent further tissue damage and potential migration to deeper structures. Following the surgical intervention, we initiated a targeted pharmacological regimen to ensure complete eradication and prevent secondary complications. We prescribed systemic antiparasitic therapy to address any remaining larval activity that might not have been accessible through debridement. Broad-spectrum antibiotic coverage was also implemented to manage the high risk of secondary bacterial infections commonly associated with myiasis wounds. We are pleased to report that the patient showed an excellent overall response to this combined surgical and medical strategy. The tissue showed signs of healthy regeneration, and the infectious process was successfully halted within the first few days of therapy. This case highlights the expertise available at the Cittadella Hospital and the ULSS 6 Eugenia network in managing rare infectious threats. Dr. Miotti's findings underscore a critical reality. Parasitic infestations are not limited to tropical regions and must be considered in our diagnostic protocols. Even in temperate and high-income countries, factors like advanced age and immunosuppression can create opportunities for these rare conditions. This case report serves as a reminder for clinicians to maintain a high level of diagnostic rigor when presented with unusual localized symptoms in vulnerable patients. The successful outcome was the result of seamless interdisciplinary collaboration between surgery, infectious disease specialists, and entomologists. By publishing these findings, we contribute to the global medical knowledge base, helping others recognize and treat similar cases in the future. Ongoing research in medical microbiology continues to reveal how environmental factors and host health intersect in the spread of parasitic diseases. Increasing clinical awareness is the first step in ensuring that patients receive timely and effective care, regardless of the rarity of their condition. In summary, this case of facultative auricular myiasis was successfully managed through precise identification and a rapid interdisciplinary response. We acknowledge the dedication of the entire medical team involved in this case and the support of the ULSS 6 Eugenia network in Italy. For more detailed clinical insights, we invite you to review the full article in the journal Microbiology and Infectious Diseases. Thank you for joining us for this clinical case study presentation. Stay informed, stay vigilant, and continue the pursuit of medical excellence. Our commitment to the highest standards of patient care and research remains our driving force in the field of infectious diseases. Through shared knowledge and clinical innovation, we can overcome even the most uncommon medical challenges on a global scale. Presented by SciVision Publishers, advancing the frontiers of clinical research.